Hi everyone, this is Dr. Bill with Easy to Pass and Clicks, easytopassandclicks.com. This session, I'm going to be talking about sickle cell crisis. What is sickle cell crisis? The pathophysiological approach, I'm going to break it down simply. So, the normal blood cells or the normal RBCs or the heme shape is actually a donut shape, to make it simple. When it's a donut shape or the circular form or the spherical form, it's able to carry oxygen from tissue to tissue, organ to organ, or cell to cell easily, right? But in sickle cell, hence the name, it's not the sphere shape anymore. It's basically in the form of sickle or an S, simply, if that helps you remember. So when that happens, it's not able to carry the oxygen like it should from organ or tissue to tissue. What also happens when it's sickled shape or it's sickling? It pulls together, right? It clumps together. It sticks to each other. It sticks in the blood vessels. So the blood is not able to move freely as it should with the normal heme shape or the sphere shape, okay? So what happens when the sickle cells are pulling together or forming clumps together? It causes pain at the site. That's why a lot of sickle cell crisis is, exacerbated or is, presented as a lot of excruciating pain because of the pulling of those blood cells. What are some triggers or let's consider risk factors of sickle cell? Risk factors include stress, dehydration, high and low altitudes. Those are risk factors. And sometimes infection can also cause sickle cell crisis, and as well as hypoxia, which is in this case, it's one of the symptoms of sickle cell. But it's also a trigger because when people go into hypoxic episodes, it also exacerbates or worsens the sickle cell crisis. The population that is affected or that are affected the most is usually African Americans, Mediterranean descent. And that's not just them. It affects other races and population as well. But it's just that those are the highest, risk, or the statistically, those populations are affected the most. So in this case, what are going to be the presenting symptoms for clients with sickle cell or sickle cell crisis? They're going to be having a lot of pain or excruciating pain, which is exacerbated due to the sickling, the clumping, and the pulling of the blood cells in the blood vessels, joints, wherever. Okay, pain. They're going to also have some hypoxic episodes. They may be hypoxic when you check the oxygen saturations. Often at times they have low oxygen level. And that's because the blood cells doesn't have the regular sphere shape to carry the oxygen from tissue to tissue. So they have low oxygen in the blood. What else do they present with? Oftentimes with pain and low oxygen level. They also have some tachycardia, dysrhythmias possibly. And then these can also cause complications such as organ failure. It can affect the lungs. It can affect the kidneys. It can affect the heart. Okay. And then it can also affect the brain. So it can lead to stroke because if the blood is pooling, it can clot easily. And then it can cause stroke. It can cause kidney failure. And then also can cause some heart failure as well. So notice with these signs and symptoms and potential complications, as much as or as well as acute chest syndrome. Complications of acute chest syndrome can be seen in signs and symptoms such as pain, pleuritic chest pain. They may also have some dysrhythmia and then some heart failure. And then some oxygen level will be decreased. And then also it can lead to infiltrate in the lungs. Okay. So what are some treatment? What are some treatment for sickle cell? Based on what we've discussed as the pathophysiological findings, such as pulling and sickling of the blood, you want to hydrate the client. When you hydrate the client, the blood is able to move, freely and flow seamlessly from organ and tissue to tissue. You also want to medicate the patient with some pain medications. Provide some pain medications to alleviate the pain that they are going through with the pooling of those blood, especially in joint areas. You also want to provide some oxygenation. Oxygen help. Remember, they may present with hypoxia. So you want to give supplemental oxygen. And then also, you want to treat any underlying cause. So if it's an infection that triggered it, you want to make sure that infection is addressed. Treat that infection. If it's stress, teach the client to practice some stress relief activities such as deep breathing and some relaxation. And also try to remove the underlying causes of the stress or manage or cope effectively.